Good afternoon, ladies and gentlemen. Thank you, Professor Kwang Wong Lee and Professor Han Wong Lee, for the kind invitation. Thank you for having me here to present our work. I am Kai Wang from Department of HPB Surgery, Zhejiang University School of Medicine. Today, I am going to talk about the prognostic stratification in salvage liver transplantation, which is from a Chinese cohort study. As we all know, liver disease is the 11th leading cause of death all over the world and resulting in over 2 million deaths each year. In China, this disease burden is more than 450 million people. And we can see, both in China and America, HCC is still the major cause of liver-related death, and the morbidity and mortality is still keep increasing. Liver transplantation is considered is the most effective treatment for end-stage liver disease. With the efforts and guidance of outstanding surgeons like Professor Su Shenzhen, the LT cases in China is almost up to 7,000 each year and has become number 2 in the world. And our team has published a review paper and highlights the Chinese experiences of liver transplantation over the last 2 decades. Each year, almost half of the global liver cancers cases were diagnosed in China, and the liver cancer is still the number 1 cause of death in middle-aged Chinese population. So that in China, over 40% of LT cases were for HCC, which was significantly higher than those in Western countries and Japan. Therefore, the Chinese LT doctors exert great efforts to improve its long-term outcomes. In the field of LT for HCC, the candidate selection criteria is remarkably important to balance clinical benefits and tumor recurrence risk. Almost 30 years ago, Professor Mazzaferro proposed the Milan criteria, which significantly improved long-term survival in HCC recipients. After that, different criteria were emerged all over the world, and all of them were only based on tumor number and tumor size. So many liver transplant teams in the world were intending to integrate tumor biomarker in the selection criteria, such as Professor Su Shenzhen and Professor King-Suk Su. They believe that if the tumor is quite big, the AFP level must be lower than a significant cutoff value to make sure the recipients could have a favorable prognosis. In order to relieve the organ shortage to some extent, salvage liver transplantation was proposed to perform partial liver hepatectomy, firstly as a bridging treatment, followed by liver transplantation if the tumor recurs or liver function failure. In order to investigate if both salvage and primary liver transplantation could yield similar outcomes, Professor Renan Adam and its colleagues conducted a study including 31 HCC recipients with SLT, finding that no significant difference of the DFS and OS between the SLT and PLT groups after a long-term follow-up. And on the right-hand side, from a Korean study, which is including more than 100 HCC recipients, which is from Professor S.G. Lee, also reported a similar result. Although quite a lot of work has been done in SLT, the majority of the studies were only based on single center with small sample and were descriptive studies without data matching analysis. So here we conducted a study based on a nationwide multi-center cohort in China with propensity score matching analysis. And more importantly, we have proposed a novel prognostic stratification of recipient selection in the salvage liver transplantation. During 2015 to 2019, more than 23,000 liver transplants were performed in China, and more than 8,000 cases were for HCC. After a multi-exclusion steps, we finally get 750 salvage and 3,500 primary LT included in this study. And we've got three major aims. The first one is to compare the OS and landmark survival between SLT and PLT based on a PSM analysis. The second one is to compare the OS and DFS between the SLT and PLT within Milan and Hangzhou criteria. And the last one is to determine the independent risk factors and develop a prognostic stratification for SLT. Okay, now let's look at the baseline data between the salvage and primary liver transplantation in the study. After a propensity score matching with a 1-to-1 ratio, there are 728 recipients in both groups. And also, we can see all of the major variables were adjusted to be statistically non-significant between these two groups, such as the BMI, the Child-Pugh grading, and AFP, and so on. Then firstly, we compare the OS and DFS in these two matched groups, and we can see no significant difference was observed. And then we conducted a landmark analysis. When you look at the survival curve on the left-hand side, we can see that if the recipient survived more than 1 year, the probability to survive an additional 5 years showed no significant difference between these two groups. And similar results were also found for those survived for more than 2 years, which is on the right-hand side. In the first part, there were no significant difference in survival between the whole SLT and whole PLT population. So next, in the second part, we did a subgroup analysis. Firstly, we compared the survival outcomes for recipients within Milan criteria between these two groups, showing that the prognosis of recipients in PLT group was significantly better than those in the SLT group. And also here, similar results were also found in the recipients within Hangzhou criteria between the SLT and PLT groups. So it seems that the current selection criteria for PLT may not be suitable for SLT. So this issue enables us to consider to establish a novel prognostic stratification specifically for SLT. In the third part, in order to develop the prognostic stratification, univariate and multivariate analysis were conducted, and we can found that AFP level, tumor maximum size, total diameter, and preoperative TACE history were the 4 independent risk factors associated with SLT prognosis. Based on these 4 independent risk factors, a novel nomogram for SLT selection was established. The model discrimination was evaluated by using C-index analysis, which showed that it could predict 3-year OS precisely. Furthermore, based on the median value of the nomogram risk score, the SLT population were divided into low and high risk groups. And we found that OS in the low risk group was significantly improved when compared to the high risk group. More importantly, when we compare the long-term survival between the PLT within Hangzhou criteria and the SLT with low risk, we can see there are no significant difference was observed, which means that this prognostic stratification could be applied in SLT population properly. Okay, these are all the results from this study. And at last, I'm going to talk about and focus on HCC biomarkers and taste application for a further discussion. Firstly, the AFP, as we all know, it is an important marker in tumor biology and for post-LT prognosis. Almost 10 years ago, our team conducted a nationwide study enrolling more than 6,000 patients. Based on the cutoff value of AFP less than 100, the recipients within Hangzhou criteria could be further divided into type A and type B group. And the 5-year tumor-free survival rate in type A could reach nearly 70%. And also, PIVCA is another important HCC biomarker. And over the recent years, more and more studies demonstrated its important role in the prognostic stratification for liver transplantation. In this study, we enrolled 6 liver transplant centers in China and found that incorporating PIVCA2 into the Hangzhou criteria could further increase the eligible number of HCC candidates by 21% without compromising the long-term outcomes. Therefore, in the future, we can further consider to incorporate PIVCA2 into the SLT selection criteria. And secondly, I want to talk about the pre-LT TACE application. We can see the table on the left-hand side was from another SLT study. And it also indicates that preoperative TACE was an independent risk factor for the successful SLT. Additionally, the figure on the right-hand side is also from our study, showing that recipients who received TACE downstaging but failed reaching the midline criteria will not benefit from the sirolimus therapy. However, those without TACE downstaging could benefit. So finally, in a conclusion, due to the current issue of organ shortage, not all of the HCC patients should be considered for PLT right away. And salvage liver transplantation is still a feasible approach if the tumor recurred or liver function failed after hepatectomy. In this nationwide cohort study from mainland China, the existing criteria for PLT might not be suitable for SLT. So based on this nomogram risk score model, we believe that well-selected SLT recipients could achieve a comparable long-term prognosis as PLT recipients fulfilling current criteria. So more efforts should be made to explore more, and international cooperation and multi-center cohort study is warranted. And finally, I want to express my sincere gratitude to all of the liver transplant team in China for their kind cooperation and valuable expertise during this study. And also, I want to thank NSFC and the Ministry of Science and Technology for the financial support, and the Zhejiang University and Hangzhou Medical College for provide a wonderful resource and a facility. And this is for my talk and presentation for today. Thank you very much for your attention and welcome to Hangzhou. Thank you.